Alright everybody, how is everyone? I know it's a weird way to start out my new video, but I wanted to start out by saying that this is going to be a pretty gory video. So if you have a hard time with wounds and pus and blood and all that kind of stuff, I would suggest you not watch this video because that's what we're going to be talking about. And I'm going to also show how I clean it and prep it and everything. And show you the status of it. It's a tumor to my chest wall that has broken through. I've had it radiated, and that was last year, and now it's just an ulcerating sore that just keeps growing. Not sore, but cancerous spot that keeps growing. So please go on to the next video. I have plenty of other videos if you can't handle that kind of stuff. For everyone else, what you are looking at right now is, or should I say are, all of the things that I use to help treat, clean, and prep my ulcerating cancerous sore. I guess that's what we'll call it in this video. I don't know. I might just call it my sore. Anyway, yes, I was a dental assistant, so that's why I'm setting it up as though I was a dental assistant. I don't have the trays or any of the instruments, but this is what you get. I also want to say that I washed my hands and I sterilized and cleaned everything that is here. And so if you're worried about that, it's all been cleaned, and I do know how to properly clean it up after I'm done. So I have the gloves, I have the scissors, I have some cotton swabs, or cotton balls, and in that little container right there, which is a raccoon coming out of kind of like a tree trunk or something, in there are some cotton swabs, because I use those to apply some of the medicine. Right there is some tape. I am getting really running out of it, so I'm going to have to use my tape sparingly. And right there is something I will be putting my used cotton swabs in. I have some tissues if I need them. The medicine that I put on afterwards, which is called Santal, was prescribed. And then I have some napkins. And I know this is very strange, but yes, I do have part of a maxi pad because on the back it's been used already, and I will explain why. Those of you who might watch my videos and watch my other stuff will know why I have that. And then right here, this pink jug has a solution that was prescribed to me by my pharmacist, or by my doctor, and when I went to pick it up, it was way too expensive. So I looked up how to make it, and it was basically a certain amount of sterile water with some bleach, and so I was able to make it, and made it for almost nothing because I already had all this stuff. So that's what's in that bottle. Okay, so now I'm back. It looks like I'm about to go swimming, but it's winter time. This was the easiest to put on because I didn't feel like doing my hair, so I just put a cap on. I do have hair underneath of this, though. And I have a bathing suit on and this on top. And I did that because where my chest wall tumor sore is very close to my breast. And if I were not careful, I could make a mistake and show you something you don't want to see. So I have my bathing suit on, so it's not covering it, and I have enough, coverage and everything. And then this will be taken off in about a minute. But I also want to point out another thing. If I didn't already mention it here, I know I mentioned it on Instagram and my Facebook page. These two necklaces are my favorite necklaces. The top one, hope you can see that. It was given to me from a wonderful organization that supports breast cancer and gives part of their proceeds to, I think, research for breast cancer. The owner of it had her best friend actually had breast cancer, and so that was given to me. It was made beautifully. They saw my daughter and I looking and oohing and eyeing over that stone and the color, the rose gold. So they gave it to me. It was very, very nice of them. The one underneath is from a wonderful YouTube friend internet friend, I guess, that I have who lives on the other side of the United States in California, and she does her videos about her breast cancer story, and thank God she's actually doing well right now. So she sent this lovely necklace that says Warrior out to me, and she has one too. So I will put her information at the bottom, so if you want to check out her channel and watch her videos, go ahead. She's an awesome person, and her story is great, and it's very similar to mine too. So I just wanted to point those out, and they're beautiful too. Now it's going to be time for me to take my bathing suit cover off. That's if I can get it off. So again, if you are squeamish or don't like stuff like sores and blood and pus, please don't watch this video, okay? That is your warning. I want you to know also that this is very red right now. I did have a bandage on it, and I had to take it off because it was weeping, I guess. It had some fluid coming from it, and it was going on my shirt. So I'd already basically cleaned it off. So this is actually not what it would look like if I took off something off of it right away. And I do have to change it about 3 times a day, because I can tell you this. If they had, and I'm sure people have said this, if they had smell-o-vision and you could smell this wherever you're watching this video, you would be like, turn off the smell-o-vision. It is disgusting. It's like rotten eggs. I really, honestly, that's the closest I can get to the definition, but it's really nasty. And it is, before I learned how to properly clean it, I wasn't sure if it was me who was smelling like that or what it was, because I was going through chemo, and it wasn't until my daughter said, "Ew, Mom, our bedroom smells weird. What's going on?" And I pieced it together, and so I do have to change it 3 times, because number one, it does pus so much and the stuff comes out. And I'll tell you what I'm doing to use a bandage that tries to absorb as much of it as I can. But also, I do change it 3 times because it smells so bad. So anyway, this has been cleaned. A basic cleanup. So it's red too, because I think it's infected. And I'm probably going to have my implant removed, both of them removed because of it, and hopefully they'll remove some of the tumors around it, because it does have small little tumors around it. And some of my smaller tumors from last week have kind of merged into big ones. So that is the warning. So go ahead and turn your heads if you don't like this, or turn it off. This is your last chance. All right, here goes. Not sure how much you can see it, because I know I do have a glare. So it's right there. Going to move slowly around. So the whole thing is like right here. That's where the outside part of it is. It was radiated last year around the same time. It's just never healed right, and it's getting bigger. I figured I would show what my tumor looks like. Okay. Can you see it? That's new. And like if you push here around, it used to only go to about like right at where the edges are, but now it goes all the way out to that area. So it's like that big now. In other words, I don't think this chemo is working. And then about a month ago, I started getting a few other spots. I do have tumors other places too, but I'm just talking about this one right now. And then all of a sudden I got another one that popped up, another one popped up, and I had about, maybe last week when I counted, about 7 of them. So I'm not sure how many I have, but as you can see, there's this one right here, there's that one right there, that one right there, there's one right here. Let's see if I can feel some. One right here. I don't want to get too close because I don't have my gloves on yet. Right there, right here. It does seem to go, if this were not my breast, because it right there, if that wasn't popped out, I think it goes about to there underneath, that deep. So anyway, that's what it looks like. Yeah, I hope you can see this. So time for me to put on my gloves. I'm not going to be overly cautious about this. Oh, I did want to point out too, all my life I've had the worst nails. They break. I've never been able to grow them. Never. And chemo's supposed to make it worse, which it actually did. My pinky is like all really warped very strangely. And it goes like, it's all the way down. I don't know if you can see that. But it's odd because just recently they really started to grow. First time in my life on chemo. Like, I have that one right there. That's really high for me. So anyway, just figured I'd mention that. Now back to the gloves. I do have lymphedema still going on, as you can see. Okay. So basically what I am told to do is take this solution that I made up and soak a cotton swab or two with this solution. And it does have bleach in it, so I have to be careful. I'm going to use this. I'm actually going to pull it out a little bit. What I'm doing now is I'm soaking the cotton swab. And I'm kind of squirting it out so it doesn't get all over. And I'm getting it on the ground. Not good, not good, because I have carpet in here. Alright, so I'm supposed to take it and just like kind of clean it off, but after I've already cleaned it off, so, and then let it kind of sit there, or if I need to get another one, I think I'm okay with that right now. It keeps dripping down, so, and then I basically have to let it sit soaked like that for 10 minutes, and I've already done this part too, so I'm not going to go through that whole thing and wait 10 minutes, so let's put some music on. Okay, it's been 10 minutes. And then you basically take it off. You wipe around. Now, a lot of times this is bleeding. It bleeds around where the yellow part meets the skin. It a lot of time bleeds. But like I said, I already cleaned it. And I really don't feel like messing with it again too much so that it starts to bleed again. I don't like that. So we're just going to take this and put it inside of there. Set that to the side. And take a napkin, wipe off my hand, and set that to the side. Then I'm supposed to put a bandage on it with this Santal, but none of them seem to keep the actual pus or the weeping that came out. So what I joke around with my sister, I held up a picture. I made a picture and sent it to her online, and I held up a very thick medical type of bandage stuff that cost a lot of money, even on Amazon, and my daughter's pad that she wasn't going to use because I got the wrong kind. And I said, which one do I use? And she's like, that's a good idea. So a week later, I went to my plastic surgeon who's treating this, and they actually said, or the person who talked to me said, yeah, that's actually a good idea. Just take one and cut it and use it because they do absorb very well. So that's what I've been using. I've been using these, cutting them, and then using them as a bandage. So I'm going to take this basically and just cut right in half because this doesn't have to be that big. Set that one to the side. And it's a little difficult because pads do have sticky stuff on them, obviously. And these are, of course, a pad with wings, so I kind of just sometimes cut the wings off, sometimes just fold them over. It doesn't really make a difference. So when it comes out, I'm going to set this to the side, but basically it looks like that. And there's the wings, and I'll show you what I'm going to do in a minute with them. So set that to the side. I usually cut strips of tape before I put the actual Santal on it, on my bandage and on my this thing. And that's only so I cut them and I just set them up in a line so I can just take it and put it right back, put it right on so I don't have like all these messed up pieces of sticky stuff. Use this one first because this one's thicker and it's much better. I'm actually going to take my gloves off for this. I did wash my hands, so probably should keep them on, but right now I'm not going to. Oh, shiz button. Oh, it doesn't look like I have any left. I was afraid that was going to be like that. Let's see how much. All right, so typically I go to about that distance, about there, and I will cut it right about there, and then I set it like to the side somewhere. Stick it somewhere. And then do another one, like 2 or 3 more about the same size. This is not hard at all. This is just what I do. You could do it your own method, however you prefer. But this is what, this part, I just do it this way. Oh, that's all that's left. Oh well. So I'm going to have to go to my other kind for the rest of this, which I really don't like it because it's really thin and it doesn't seem to be very, I don't know, it's just not easy to work with. So this is what this one looks like. And just so that you see the difference. That's the difference. And even the thickness. You can kind of see this one is a little bit see-through. And that one, or opaque, I guess. Anyway, this one's definitely thinner than this one. But I like the thinner one better for some reason. So I'm going to take about that much. Cut it. I have altogether 4 in that tiny little baby one. But because this is so thin compared to the other ones, I'm actually going to make 1 more. Have 1 extra. Okay. And then basically I take my little mini part of my pad and I take off the back. And I take the sticky tabs off of the wings. And then we're going to go fly now. I usually flip the wings back onto the sticky tab so it covers up the sticky part, because that's actually going to be the part that is pointed out. So I'm going to stick my gloves back on because this is the part where I use the Santal again. Typically also I have some cotton swabs sitting out, but I'd forgotten about that, so sorry. And at this point, if I hadn't already cleaned it, I would take a little bit more of that solution, put it on one of these, and kind of just go around and make sure I got all the little spots, especially the area around it, and I clean off the blood that's still on that area. But right now, I don't need to do that, so all I'm going to do is take the Santal and get that situated. They said about the size of a nickel. Did I see, was it a nickel? Yeah, a nickel. But I'm just going to do it in pieces, so that's what I'm putting on first and set that to the side. Okay. No, actually, I don't need to set that to the side. I need to stick it on right now. So I just basically, let's see if I put it right there. That is about good for half. And I'll take the other side. And again, about the same amount. Put it on the rest of it. I actually go a little bit on the outside more too. And oddly enough, not oddly enough, but I think I'm probably going to have to start, this one looks like it might open and I might have to start going over that, but at this time I don't. So I will take my used cotton swabs and I put them inside of this, only just because it's trash and we need to get it out of the way. Whoa, that wasn't good. And then I take my little pad thingy and I place it on it like that. place it on it like that. And now I'm going to take my gloves off again, and that's because it's going to be hard to stick the sticky stuff on, and I'm basically done with all the gory stuff. That part is all underneath the bandage. I have to be very careful because I keep wanting to move my bathing suit out of the way, but can't do that. Don't know who's watching. So, take my first sticky strip, put it like that. Second one, I just take it right there, a little overlap. Third one. Now I still have a little spots there, and because of the fact that it does weep or pus or whatever, I'm going to use the rest to cover them up. Right here, I'll use that. This is not very professional whatsoever. This is just the way I'm doing it right now. And when you're on a budget and you just have to use what you have in the house and can't just run out and grab it, a new thing, you do what you gotta do, right? Besides, this is underneath my shirt typically, so. And that's what it looks like. Sometimes if I'm going out, I'll cut this and I'll cut down there. Sometimes that part of my shirt does show, but I'm not going out for the rest of the night. Gotta clean this all up and put it all away. And I'm trying to think if there's anything else that I missed about this. Nope. Just make sure after or not that you're going to be doing this, if ever you have to, make sure that you clean up all the stuff and then properly wipe it down with something that's going to get all the bacteria away, and then also clean your hands. And that's what I'm going to go do, but I don't think you need to see that, so I'm going to end it right here. Thank you, and just pray for me, because on today is, what is today? Thursday evening, and on Monday I have my CAT scan of my chest wall. I'm already on the schedule for another chemo, but because this is still growing, the doctor was like, we're just going to get a scan, and most likely it'll show there's progression and we'll stop you. So I won't have my treatment that week. So I'll have my scan on Monday, and then I will see the doctor on Wednesday, and I will find out what I'm doing. I did talk to someone today, another doctor who is very familiar with some trials, because he does work with some local teaching hospitals. And I had mentioned that one of the genomic testing said that even though I'm triple negative, meaning I do not have the estrogen, progesterone, or HER2 type of cancer, I do have one that is driven by an androgen, I think is what it is, which is a male hormone. And he said there is a current study right now that he knows about with triple negatives and that type, androgen driven, that I might want to see if I could get into. He could get me more information, or if I can't get into it, I can be put on what's called a compassionate use of it, which because if I need it and I'm not doing good because I'm stage 4, some of the stuff I don't meet the basic need qualifications to get in the trial, but I can still use it and still do it, but at my own my own hospital with my own doctor, and that would be wonderful if it works. Otherwise, the doctor will probably put me on another chemo. One he had talked about was one that starts with, I think, an E. I'm not good at the name. If I remember it, I will put it below. But, so that would mean, if he does, back to no hair. Oh well. So, please pray for me this week as I have those things. And as always, pray for me with my kids, because there's something going on that I don't talk about, but it's always a an ongoing thing that I always need prayer for. So just keep me and my kids in your prayers. And everyone have a nice day. I hope you liked the video. If you do, give it a thumbs up and maybe share it. And if you're not already subscribed, please subscribe, because I'm already at that 1,000 mark and I'm so excited to finally reach it. And I do have a giveaway once I do reach that. So that video, I think I already put one video out about it, but yeah, I'll link it below. And so that's all I have to say. You guys have a nice evening, a nice day, wherever you are. Yeah, bye-bye.